Great to be here. Great to be back in the UK after a very long gap, and exciting to be re-engaging. Well, I didn't ever quite leave the UK behind. I've been pretty much engaged on the health side since I've been away for the last 12 years, but it's good to be in closer contact. So I'm going to be talking, moving away so much from the kind of DEFRA side of things towards the Department of Health, towards the public health side, and giving a health perspective this morning. So, focus on consumption, on food consumption, then what are we talking about? These are DEFRA statistics about household purchases showing quite clearly that the British diet is suboptimal. Compared to the Eat Well plate, which was put out by the Food Standards Agency, we are consuming far too many foods and drinks high in fat and sugar, as well as salt, and far too few fruits and vegetables. That's very clear. And we know that these kinds of diets are linked with ill health, particularly particular emphasis has been placed on obesity. Here we have the obesity prevalence in England, women up to 25%, even young children at around 15%. And it's rising among men and women. It's levelling off a bit among children, but still increasing. So obesity, a real concern. And we know that obesity is linked with health concerns. Some of you may have seen in the newspapers last week the new data out on cancer, the link between obesity prevalence and cancer. And also most people who get type 2 diabetes later on in life are also overweight or obese, and we see this increasing prevalence of diabetes in England over the past few years. So that's a very quick snapshot. Poor diets, ill health associated with that, underconsumption of fruits and vegetables. And of course we know there are costs, according to the Department of Health. The latest figures suggest that overweight alone costs $5 billion, not to mention cardiovascular diseases, diabetes, and etc. But we also know there are social costs. We have excellent data on obesity in the UK, and we know that there's a strong correlation between deprivation, social deprivation, and obesity among children. So that's a very quick snapshot of the health and consumption issues. So what has the policy response been? I want to go back a bit further in time than the previous speaker and go back to 2000 and really go forward and say, well, what have the policy responses been over that period? This is not entirely comprehensive, but starting in 2000, we have the the government's NHS plan, which restructured the NHS. That was 11 years ago. Obviously, we're now undergoing a new restructuring, but that was an important restructuring then. And that was really the beginning of laying out the approach to addressing unhealthy eating and obesity. That same year, we have the establishment of the Food Standards Agency, and this is very, very critical. While food safety was the main public concern that led to the development of the Food Standards Agency, the fact that it had nutrition policy, very, very important. The following year, we start to have these reports coming out talking about the costs of chronic diseases, of obesity, of low-quality diets, starting with the Wanless report, Securing Our Future Health, talking about what a disaster it was going to be cost-wise if this continued. We had the National Audit Office report that same year, talking about talking about the costs that obesity in particular was incurring. A couple of years later, we have the Chief Medical Officer talking about obesity as a time bomb. So we have these reports that are now coming out. That year, though, we have the Food Standards Agency really beginning its work, starting with a salt reduction strategy, starting its work on salt reduction, and it's beginning to show its teeth there. Then, following year, very active year, 2004, report on obesity by the Parliamentary Health Committee, the first public service agreement target on obesity, which said that 2010, there should be no increase in obesity among children under the age of 11. We also have a very important white paper called Choosing Health, Making Healthy Choices Easier, which really set the tone for public health in 2004. That is still here with us today under the current government. We then have the what Choosing Health did is set out a series of ideas, of visions for healthy eating as well as other behaviours, including food marketing to kids, including food labelling, including mass marketing campaigns, including food in schools. And that same year, action was taken. Ofcom commissioned research on the effects of food advertising. The Food Standards Agency commissioned work on nutrient profiling of foods. And the FSA also started to develop traffic light labelling. I don't need to go into these in details. I'm sure you're all familiar with them. Following the NHS plan, we have the National School Fruit Scheme rolling out, also in 2004. That was mentioned specifically in the NHS plan of 2000. Moving on to 2004, the Choosing a Better Diet came out of Choosing Health, and that was an action plan with very specific timelines of things that were going to happen. That same year, School Food Trust and School Meals Review Panel established. Next year, School Food Standards introduced. So really action coming out here. And then 2006, we begin to see more work, a bit less work on the healthy eating side of things and more explicitly on obesity. So this was the establishment of the National Child Measurement Programme, which you may be familiar with. Very, very important programme that measured obesity or measured the BMI among children in schools in the UK. And also the NICE, the National Institute for Clinical Excellence, Clinical Guideline 43, which was on giving guidance on obesity. Then we have the National Audit Office coming out with another report on tackling child obesity. That was the Department of Health who commissioned that. And that report said, Department of Health, you're not organised enough, you're not doing enough, you need to do more. That report was commissioned by the Department of Health really to try and get others to stand up and take notice and say, we at the Department of Health actually need to be doing more on obesity. So the next year, a landmark report came out called Tackling Obesity Future Choices, a foresight report, which laid out a whole kind of systems approach to thinking about obesity. That same year, very busy year, a new public service agreement target on obesity, expert advisory group on obesity established, childhood obesity national support team established, national obesity observatory established. It goes on, lots of action taking place. And then the work of the Food Standards Agency that was started a few years earlier, now coming through to completion. So you have the Ofcom rule restricting broadcasting advertising to children, food advertising to children, and their guidance coming out also that year on traffic light labelling. So moving forward to 2008 then, we have a lot of things going on a healthy diet. We have a lot of things going on obesity. We also have things going on physical activity, which I haven't mentioned. That was then brought all together into, for the first time, an actual strategy for dealing with obesity as opposed to just a series of initiatives, as well as, I should say, £372 million for addressing obesity. So the government was really taking it quite seriously. The cross-government obesity unit was established, Department of Health and Education, DEFRA, nowhere to be seen. Change for Life was also established, a big social marketing campaign. And a convenience store program was also started at that time, which was all about putting fruits and vegetables at the front of convenience stores following a program in Scotland. 2009, Healthy Start, which was also mentioned in Choosing Health as part of the inequalities agenda, was started, which was all about providing fruits and vegetables for low-income and pregnant lactating women. That same year, More on Obesity, the Obesity Learning Centre was established. Now we're at 2010. We all are familiar with, I hope, the Healthy Lives, Healthy People White Paper for Public Health that came out of the current government. The establishment of the Responsibility Deal Food Network, and, as David referred to earlier, the transfer of the nutrition policy mandate to the Department of Health from the Food Standards Agency. Then this year, Healthy Lives, Healthy People, a new strategy on obesity. So we never got an action plan on obesity. We got another strategy, new government, another strategy on obesity, and then the disbanding of the expert advisory group on obesity as well this year. So you can see there's actually been a lot of action over the years, and a lot of my work is global, and I can tell you that England is seen as a global leader in this area for all the faults that the issues and so on that have happened. They are seen and looked to as a global leader. The amount of money, the amount of monitoring, the amount of policy changes, and the amount of strategies. So,
when you put into words your sort of quizzical face at that point.
So let's look at food policy then. I've been talking about the response from the health sector in public health. What was food policy particularly doing here? I think we can find 3 phases of action, and I start the first phase when things started to get interesting, 2004 to 2008. And that phase, when the government was saying, let's have national food standards. Let's have nutrient profiling to define what food is unhealthy and less healthy. Let's have a national restriction on food advertising to kids. Let's have national guidance on food labelling. Let's have national food standards for meals in schools. And let's have national targets for salt reduction. The Food Standards Agency was there. It was active. It was doing things. After that, though, the emphasis on food standards remained to some extent, but what became more important, it wasn't in the second phase, these issues were important before, but what started becoming more important was more targeted initiatives, more things like, putting things in the right place in convenience stores. When it came to non-broadcast promotion of food to kids, let's do a voluntary approach. Let's work more closely with the food industry. Let's do Change for Life, a big social marketing program, which is all about engaging industry on delivering. So the emphasis moved away from the food standards to more targeted initiatives and closer working with the food industry. That had been there before, but the emphasis changed. What we have now in the present is the responsibility really being moved to the food industry and the local level, which I'll talk a bit more about in a moment. So that's where we are now. So in those 3 phases, over the past 10, 11, 12 years, we've seen differences in the delivery mechanism for food policy for health. And we've seen differences in the relative responsibilities allocated. What's very important to note is that there's been an incredible amount of unity in food policy for health over the past 10 years, which has been this of informed choice. The government's role is ensuring that consumers can make the right choices. They're making healthy choices the easiest choices. That is the philosophy now, and it was the philosophy in the HNS plan in 2000. It was there then, and it's still there now. Now, one can problematise that, but let's make that clear that that represents an important shift away from the idea that the problem of over and under consumption is solely an issue of going out and buying a diet book of individual responsibility and saying other people have responsibility too. So that was an important and, in my view, a very positive shift. But what was very interesting here is that everything I've been saying also applies to underconsumption. The whole kind of underconsumption, the food poverty that Lauren referred to earlier, really was sort of applying to fruits and vegetables. It seems that the underconsumption kind of got brought into the healthy eating remit. And the whole issue around people who were very food insecure and so on kind of dropped off the radar. Unlike in the 1990s and the PAT teams and so on that was going on then, that really kind of dropped off the radar. It appears there may be issues going on at the local level. But so really the kind of underconsumption sort of became underconsumption of fruits and vegetables. And I think another thing that's important to point out is that while throughout this period there were targets, it was a clear target for salt reduction. There's a target for breastfeeding, there's a target for number of kids eating school meals. There were targets for how we want obesity reduced. There were targets for like how much saturated fat the UK population should eat. There's no real unified framework of targets and indicators. It's kind of an odd bag of indicators. There was some completely absent. For example, there was never a target on by how much food advertising should be reduced by. It was just, it's reduced, that's okay, let's accept it. There was no target for that. So you kind of have this mixed bag of targets and indicators and expected outcomes. So then moving forward, what are the key challenges for food policy for diet-related health? Going through this very quickly, I think the first one is localism, and I want to go back here to the call to action on obesity, which came out this year. And this reflects the entire change that is going on in the NHS and in public health in England and in the UK today, which some of you may not be so familiar with because it's been very focused on the health sector. And what they say, what the government are really saying is that we're going to give local government the lead role in driving health improvement. They're uniquely well placed to lead efforts to support individuals in achieving and maintaining a healthy weight. So they're really moving responsibility onto local government for delivering public health. But will local government, this is a challenge because will local governments have the incentive to work on food consumption issues? They have an obesity target which they want to meet. Bariatric surgery, commissioning weight management services, boot camps. These may be the preferred options when you've got obesity in mind, as opposed to food and food consumption in mind. Food policy could just get completely lost. And the whole national standard issue, if that doesn't give a framework, if that doesn't give guidance, then unless you've got a sort of food hero working at the local level, then there's a potential for it to get lost. The other issue is cross-sectoral. The reason why the current government say that they want public health to be a local issue is because they believe that's the best place for cross-cutting, cross-sectoral, joined-up policy making. And they're going to create something called Health and Wellbeing Boards, or Shadow Health and Wellbeing Boards, to deliver on this. So this idea is that local government's the best place to deliver cross-sectoral solutions. But we know already that at the national level, cross-sectoral delivery on health has been very, very difficult. Even though it was a cross-sectoral obesity strategy, it really remained in the Department of Health. It really was health departments going to other sectors, please can you help us? Not, please help us. And you see that at the local level as well. Hasn't actually delivered particularly well obviously there are exceptions to that. And also we know, and we're going to hear about this later, we have a lot of local food action, a lot of local food projects, a lot of very dynamic thinking at the local level on food. Are the health people going to even know that's there? So that's an issue that we in food policy really need to be paying attention to. The third challenge, food industry engagement. The other body to which responsibility for food policy health was handed to by the coalition government was the food industry. And they said they must play their full part. But the question is, can the food industry play their full part when there's no real framework for exactly what they should be doing, apart from you do it? And there are some companies who are willing to go way beyond the targets that have been set in the responsibility deal. So are they able to play their full part when they have to lag behind others? Otherwise, they're going to be competitive advantage will be lost. And the other issue is we're talking about localising public health, localising food policy. But food industries, often they're global companies, they operate at a national level. Are they going to have to devolve their structures in order to deliver public health? If the food industry is going to deliver public health, it can't just be at a national level, it has to be at the local level. So is the food industry going to expect it to change its whole kind of delivery system on corporate responsibility? That's another issue and a real challenge. And what this comes to is the real challenge here is who is responsible for food policy for public health? Who is really responsible? Will food policy for health just become someone else's responsibility? The food industry, the local level, the other sector, the Department of Health. Whose responsibility is it? And the fear is that food policy will get lost in that discussion. I should add that this is my short to medium term challenge. I have lots of bigger challenges to do with the whole kind of choice issue that I won't go into now through lack of time. So I'd like to just say I see two policy scenarios for the future. One is that food policy gets lost in localism. But the second, much more optimistic scenario is that food policy gets found in localism, because the work that's been done on food at a local level becomes upgraded to the national level, which interestingly is to a certain extent what you see in the United States at the moment. And also there might be such high demand for national level action by the local level that actually might lead to a resurgence of food policy. So I'm going to leave you with an optimistic note. Thank you.
Very good.